I have a little heart to heart this morning. At least once a week, a couple times a month. I get a lot of you, same people in my DMs, or I'll pop out a question and then you ask me a question, then I reply back. And some of you are local, some of you are not. And when we're talking about the symptoms that you're having, you're like, gosh, I did the right thing. We've talked about this. I went to a pelvic floor PT. We did these things, but I'm still having issues with running, jumping, leakage, running downhill, workouts, that kind of stuff. And you're like, I did therapy, but this is still not good. And then when we kind of talk about what your therapy was, there was nothing specific to lifting, running, jumping, all the things that you're having problems with. Or if it was very kind of like rudimentary basic stuff. And it's one of those things where this will happen over several months period of time. And I'll be like, hey, I'm happy to help you with that. Definitely that's kind of my jam. And I know everybody kind of has to come to decisions in their own way. But I want to share a little story here. I had issues with leakage, prolapse, diastasis, primarily after my second kid. I think there were a little bit of leakage after my first. This was also, my daughter's 10, my son's 13. This is a long time ago. We didn't know what we know now, right? And the rudimentary stuff was not even running specific, lifting specific, that wasn't even on the table back then. This very basic stuff that a lot of you are getting now, that's all that we had as providers. And I did that stuff, and spoiler alert, it didn't work. I still had issues, okay? And I had a choice at this point. It was like, oh shit, this is all there is. I'm not going to be able to run. I wasn't lifting at that point. Is this what I'm going to have to deal with the rest of my life? And I think partially because, one, I'm really not good at accepting mediocrity. Blame my parents for that. But also I was like, I'm always that person where I'm like, the answer is out there. It's just up to me to find it or find that person. And inevitably it's not the answer exists in the universe, but sometimes there's not that person. And I think also because of my roots in sports performance, orthopedics, that's where I came from before I was in pelvic floor PT. I was like, well, the answer's somewhere. And so that's when I started going down the rabbit hole of doing pelvic floor work literally outside the pelvic floor. And fortunately, our profession has kind of erred in that direction. And parallel in all of this, we have more women returning to activity in postpartum. We have more amazing performances and high-level athletes doing, winning races, competing in meets, that kind of stuff. And we have more people that are participating in sport in pregnancy. And so all of these social changes are improving. There's this also kind of acceptance of, looking at the entire body holistically, not in a granola sort of way, but look at pressures and look at, how the rest of your body functions in running and simplifying. That was going on. Plus the acceptance of things like cross training, Olympic lifting for runners, and also for PTs. 2013 PT, especially pelvic floor PT, hated CrossFit. It was ugh. And we were like, oh no, you shouldn't pee when you lift, but we had no solutions. Now we have much more solutions. We have much more understanding. There's more of us who are actually doing those activities. There's more research. We have a lot more information. And so that allowed some of us, ironically, very independently, to come to a lot of conclusions about this basic stuff doesn't fill the gap. And so if you are a lifting informed, running informed, sport informed pelvic floor PT that has another foot in kind of sports and orthopedic land, this is our jam. This is our zone of excellence. This is where we problem solve the best. And so this was something that over the years that I navigated professionally for myself, and also have navigated with my own personal symptoms. And I've been quite open about that. That's years. And this is my day job. So for those of you that are like, okay, I did the basic stuff, and then you ask the questions, and I'm like, yeah, no, there's a path forward. We've got to do all this stuff, and there's a lot of problem solving involved, and it's a little bit of an in-depth process, and it's very individual. For those of you that are like, nah, I got it, let me DIY this. Can we just jump to the ending here? And let me tell you, like, it took me years, and this is my day job. You are not going to DIY this shit on your own. You're just not. And you're kind of torturing yourself month by month, day by day, watching other people doing it. Like, we're actually going to have a researcher looking at comparison and motherhood on social media tomorrow. I'm going to interview her on the podcast. Like, it's torture, and all it might take, and I think this is the hard part too, is we envision what this is going to be. Oh my God, I can't do 6 more months of twice a week PT, and I can't fit in my schedule, the finances, all that stuff. Sometimes it's as simple as like 2 or 3 visits. Like, no joke, not even kidding. I'll give you an example. I had somebody recently, she met me at a local workshop that we did on impact. And I gave some general recommendations in the 1 hour class. There was probably like 15 people. And when you give general recommendations, as I've told you before, a third of the people, it doesn't matter what you give them, it's going to be fine. A third of the people will respond to that recommendation, and a third of the people, they need something more specific. And so she was that person where she's like, it didn't really cut it, but I think there's more to it. And she came in, and I think 1, maybe 2 visits, she's like, okay, we're good. And that's all it took. And I think that's the hard part too, is we set up these barriers that we think it's going to be this dramatic, massive thing. But the fact of the matter is, because I went through this myself, because I spent all of those years, I mean, my daughter's 10 now, like, I spent a lot of time and effort on this, and because it's my day job, I'm really good at this problem solving stuff. People that are running informed, sport informed, lifting informed, like, this is our jam. We know the nuances, we know the problem solving, and we know that there's a huge gap between the basics that you get in general pelvic floor PT and what it is that you need to do. I love the fact that everybody's going. There's far more providers in this area than there ever were. I used to know everybody, and I'm not even remotely close now. That said, general pelvic floor PTs, you need to know when, like, you've maxed out and know where to refer for that next step, or take the training and figure out how to make that next step yourself and fill that gap yourself. But I'm incredibly passionate about it, and I'm get a little frustrated because you can only pop into my DMs so many times before I'm like, I literally can be sitting here with the answer that you can have in a matter of weeks. And I feel like kind of a little gross saying that, but kind of at the same time, like, I have enough examples over the years of this happening and having navigated it myself. I'm sitting here with answers. What are the barriers that you're throwing up that say, no, I can totally figure this self out. I can figure my problems out. But 6 months later, it's still the same thing. Like, stop kicking the can, I guess is what I'm saying. There's nothing to lose. There's nothing to lose. And it's not a big, massive, like, twice a week. I'm literally, again, this last client I'm telling you, it was, a month ago. We did 2 visits across the span of 3 weeks, I think is what it was. And she went completely asymptomatic. She's like, no, I'm good. And even the first visit after she came back, she's like, yeah, no, I got most of it. And then we just fine-tuned a couple of last things. So my question for you, if you're feeling called out, you know who you are. If you're feeling called out, what are those barriers that you're throwing up to say, no, I'm not willing to take this next step. I'm willing to sit here and not do what I love to do, even though those answers, to even get some improvement, even if I can't help you fix everything, just some improvement in quality of life. What are those things that are stopping you? And it's hard. I do it to myself. I'm like, oh, no. It's the anticipation that's worse than the actual thing. Like, oh, what if it doesn't, just pull the trigger, go. I'm really nice, I swear to God. But it's just one of those things where you see it enough times, and I just wish I could put my head into your head, you know who you are, and just show you that it really doesn't take that much. It just takes laser precision in problem solving. And if you get the right stuff, And it's a collaborative effort too. Like, you come tell me what's wrong, I'll give you some things to play with. You tell me what's working and what's not, and then we hyper focus on those last residual pieces. It's that problem solving stuff that I cannot, as much as I would love to try to give free information and free advice, and I do that, but sometimes it comes down to that individual problem solving and letting me hear all the details and ask the questions that we really hyper focus on where the issue is, give you the right recommendations. Otherwise, you can try all the stuff that I've posted over the last 6 years on Instagram. Yeah, you get there, but it's going to take you probably 20 years to get through it all. So, moral of the story is this. Let me know the barriers. Like, DM me. If it's something where you're like, yeah, I don't really, I know this, I get what you're saying, but I'm still feeling hesitant about reaching out to a running informed or lifting informed or sport informed PT because of X, Y, and Z. Like, let me help you kind of walk through these problems and maybe give you some examples of other people that kind of did the same thing. And again, please don't forget, like, I've had all the issues as much as I really wouldn't have wanted to. It's really helped me kind of understand those things. So if you're somebody that this is kind of what you've been navigating, hop in my DMs. I'm happy to help you kind of walk through the process. I'm happy to help you walk through those barriers. If you're a pelvic floor PT and you're feeling called out because you think you might be that person that's just giving the basics, and you're ready to go next level, definitely let me know. If you're fine with the basics and you're fine with general population and you want to get connected to more running informed people or sport informed or things like that in your life, like, that's huge too. I don't care which way you go, but there needs to be that piece of it if you're going to be working with mom athletes. So anyway, hop in the DMs. I want to hear from you.